Winston Churchill said healthy citizens are the greatest asset any country can have. And that is why the Zulum administration in Borno State is championing a new era of revitalized healthcare delivery across the state that badly needs improved access and quality service. Hello there. Welcome to this week's edition of Rising Borno, Path to Prosperity, where we spotlight and showcase the transformative journey of Borno State under Professor Babagana Umar Zulum. My name is Abdullahi Ahmed. Let's get started. Welcome to the program once again. Now, the impact of Boko Haram's insurgency across Borno State's healthcare industry has greatly upended access and service delivery, with the displacement of millions of residents across the state and the destruction of health facilities leading to a disruption of services. For years, citizens couldn't access medical care across most parts of Borno State due to limited services as a result of the destruction of over 300 hospitals and clinics. Now, this trend is drastically changing since the inception of the Zulum administration in the state, with a complete turnaround in infrastructure and services. Now, the 2023 budget of Borno State, for instance, captures 19.9 billion naira allocation for the healthcare sector, for a record breaker for budgetary allocation in the healthcare sector.
Now that peace has been restored to greater part of the state, we want to embark on meaningful projects that will touch lives and properties, lives of the people of Borno State, especially in the areas of school, in the areas of health, as well as in the areas of human capital development. People of Borno State should expect more dividend of democracy, especially in the provision of affordable healthcare delivery system.
Now, the Zulum-led administration in Borno State has over the years executed over 556 projects, and 77 of those projects in just 4 months of his second tenure in office. The healthcare sector, under the stewardship of Governor Babagana Zulum, continues to receive unprecedented commitment from the government, leading to a total transformation with the construction and rehabilitation of hospitals and clinics in affected communities and territories that lack access to basic healthcare facilities. Of the 556 projects executed so far, Governor Babagana Zulum has delivered 58 capital projects in the healthcare sector, which includes the establishment of 74 primary healthcare centers across Borno State, the construction of new doctors' quarters, and an overhaul of 8 hospitals in MMC, Biu, Damboa, Monguno and Magumeri areas, as well as the ongoing construction of Borno State Teaching Hospital and College of Nursing and Midwifery in Monguno and Goza local government areas, including the recruitment of new healthcare workers.
From the health sector perspective, His Excellency Professor Babagana Umar Zulum, MNI, has a soft spot for health, as health is wealth. And without health, nobody can carry out his or her function satisfactorily. As a result of which, he has been looking into bringing universal health care coverage nearer to the people of Borno State. I have earlier told you that we have lost nearly 50% of our health institutions. So he has started rebuilding these health facilities, especially primary healthcare facilities throughout the state. For example, we have had nearly 700 primary healthcare services within the state. But as of now, you are looking at about 300 ones which are functioning. And therefore, we still have a long way to go. And constantly, new ones are coming on board. And if you may recall, recently, when as part of his 100 days into his second tenure, he invited the Vice President, His Excellency Senator Kashim Shettima, And one of the projects he commissioned was a primary healthcare center in Shuari 2, which you may wish to visit so that your viewers can be able to see firsthand the kind of healthcare facility that Professor Babagana Omar Azulum has been rebuilding, reconstructing, or building all entirely from scratch for the people of the state. Last year, he's opened quite a number of such facilities, and you may wish to visit the Wulari Primary Healthcare Center, Abaganaram Primary Healthcare Center, etc., etc. These are the ones that are very close by, where you can pop in and see for yourself. You can also visit outside the capital, Maiduguri, where you will see that such facilities do exist and they are functioning. As a matter of fact, he's put so much effort into the primary healthcare services, whereupon staff have also been engaged and staff have also been retrained, so much so that recently we have assessment carried out by independent valuers who came and assessed our primary healthcare services in Borno State, just like other states in Nigeria. And I'm very pleased to inform your audience that Borno State emerged as the best state in Nigeria, for which we were handsomely rewarded. And this is the singular effort of His Excellency, Professor Babagana Omar Azulum, MNI, for his efforts to ensure that health is brought to the doorsteps of the citizens of Borno State. And furthermore, as I said, some of our health facilities are, hospitals which were destroyed as a result of insurgency, and these are being reconstructed. Those which were not totally destroyed, and in some places, such as Dambua, for example, the health facility is being occupied completely by IDPs, and therefore His Excellency has graciously agreed to, build new hospital for people of Dambua. So we have 41 secondary care facilities, and recently, as part of his 100 days in his second tenure in office, he has graciously distributed drugs for the use of maternity services, that means pregnant women, to the tune of 800 million naira. And this has already been dispersed to all the facilities that are, so that our pregnant mothers will benefit from such generosity of His Excellency. And also, His Excellency has given the award of contracts for 2 schools of nursing and midwifery in Borno State. One of them will be in Monguno, which is in the southern part of the state, and the other one is in Goza, which is in the southern part of the state. This will improve the situation of the depleted human resources for health, meaning staff required to run these health facilities, both in our primary healthcare services, as well as in the secondary and even tertiary care services. And also, furthermore, your viewers may wish to be informed that there is ongoing construction of a tertiary center, aptly called the Borno State University Teaching Hospital and a medical school. It's situated just after the university, Borno State University, and I may wish you to visit the facilities. It's already reached advanced stage where, hopefully in the near future, such facility will be commissioned. And this will provide tertiary services to the citizens of Borno State and even beyond. And also the university, Borno State University, has got a medical school now, and which has already advertised for students to be admitted to read dentistry, medicine, pharmacy, midwifery, and nursing. And this is to really address in a long term the human resources for health. and also to reverse what is often referred to as brain drain, where healthcare personnel are being, going to so-called greener pastures, such as Saudi Arabia, such as United Kingdom and United States of America, to mention but a few. And therefore, by the time we're able to put all these institutions in place, even if some of those trained happen to go to these so-called greener pastures, then we will still have ample staff to be able to remain to look after the citizens of Borno State. So we've recently, in the last couple of weeks, have carried out training called clinical governance, where the staff of our healthcare facilities have been trained on how to look after patients in line with best practice, and how to and how to protect patients at the same time supporting such staff. And this ethos of clinical governance is, as practiced in the western part of the world, brings about respect for patients being treated. It gives dignity for patients being treated, and it gives patients empathy when they come in unwell to our healthcare facilities. And furthermore, such training also included practical access to care kit, which is called PAC, which has been approved by the World Health Organization. And this is centered on our primary healthcare staff, so that they can actually have their own manual that they follow, from the medical doctor in the primary healthcare to the nurse, to the midwife, to the JQ, to CHU, etc., so they can see when they can refer patients instead of hanging on to them to secondary or tertiary care, and also standard treatment recommendations have been laid out. So all these have been done, and under the leadership of His Excellency Professor Babagana Umar Zulum, and this is caused, which has been brilliant. And I shall also mention to your viewers that Professor Babagana Umar Zulum, MNI, has also graciously signed into law a bill called Drugs and Medical Supply Agency, as part of his 100 days in his second tenure. And this is the game changer, because this law has, as I said earlier on, establishes an agency which will be solely charged to look after the drug supply of the state. And also it will ensure that all the drugs coming into the state are bought from drug manufacturers, and which means we'll have a heavy discount when we go to buy such drugs. And also it is very reassuring for your viewers to know that the out of stock syndrome that actually bedevils our health institutions will be a thing of the past. And also these drugs are coming from very sure source, and therefore fake drug syndrome is also going to be a thing of the past.
The health sector under the administration of His Excellency Professor Babagana Umar Zulum, MNI, Members of Nigerian Society Engineers, CON, has achieved a lot, especially in his first tenure, and then he is now into the second tenure. A lot has been achieved in terms of health sector. So many primary healthcare centers has been built across the 3 senatorial zones of the state. There is improvement in the secondary health facilities. When you talk of primary healthcare centers, it's like here in Maiduguri, primary healthcare center has been opened in Abaganaram, in Gwange, in Goni Damgari. If you go to the southern part, there are also a lot of primary healthcare has been commissioned, and also still in the northern part of the state. There is also plan to build a College of Nursing and Midwifery in Monguno and Goza. This one construction has already started. And also the Borno State University Teaching Hospital is upcoming now. Building its own has already gone far, and very soon the medical college will be started in the Borno State University, that is training of medical students. So all these ones are also, there's a lot of achievement there. There is also a recruitment of 1,500 various categories of health workers. That is doctors, nurses, midwives, and other categories of health workers. Recruitment has already been done. Letter has been issued out. The staff have been posted to the various health facilities to start giving out services. So you can see that all these ones, they are all achievement under His Excellency's administration. There's complete revitalization of the health sector. Yes. So there is difference between now and before he came into office. So since he came in, there's a lot of much improvement in the health sector. The insurgents have destroyed most of the health facilities, So, and there's a lot of exodus of health staff from the state and others. But as soon as he came in, there is those health sectors that have been destroyed have been rebuilt. New one has come off. As I told you before, staff have now been recruited to replace those have left the state due to maybe the insurgency and all these things. So there's much difference between before and now.
The state government is constructing a university teaching hospital and a medical school, which I can assure you is expensive, is massive. And I really encourage you to pay a visit to the facility and see for yourself how the state has spent such huge amount of taxpayers' money in making sure it's come to fruition. And that is the game changer, because if we are able to kickstart the training of our personnel, both medical students and dental students and other paramedical staff, to be able to man our institutions, and also getting the doctors trained in line with best practice, in line with clinical governance, and also get specialist training, which have recently been approved for some departments, such as obstetrics and gynecology in the state specialist hospital, such as radiology in the state specialist hospital. Now this is going to go into other departments eventually, and therefore we can be able to produce all the specialists that we would want to see within the state, and place the state in a position to offer all the services that are required for its citizens.
Meanwhile, an additional 77 projects have been executed, which includes 430-bed capacity and nurses' quarters in Goza, MMC, Mafa, Konduga local government areas, and the procurement of 800 million naira worth of drugs and other health consumables in the second term of the Zulum administration, and more is expected to be unveiled soon. Now, the healthcare sector is not just wearing a new look across Borno State, but also is appearing to have much more equipped and a lot more staff with qualified workers to get the job done. Dr. John is among the medical workers employed by the state government recently, and he says the efforts of the governor means a lot for host communities across the state in ensuring the prevention and control of diseases across the state.
In the years ahead, with His Excellency's support to health sector, we are expecting to see much improvement. Yes. I also did not mention about drugs. Drugs have also been purchased. Under the drug revival fund scheme, and then free maternal drugs are also there for the health facilities now. Now, very recently, there is approval for what is known as Drug Management Agency. This one is an agency, it's a new one. So this one will make sure that there is enough supply of drugs in the state for the health facilities. It's a new agency that came on board under His Excellency. He has already approved the starting of this Drug Management Agency. So we are expecting to see a lot of changes, much improvement in the health sector in the second tenure of His Excellency. We won't say that there are no challenges. The challenges are there, quite okay, but then we can surmount the challenges. His Excellency is ready to surmount those challenges. I told you before, manpower, health, doctors, nurses, and all this, but now with the recruitment, that challenge will also taken care of. With the drug management agency, there will be supply of drugs and medical equipment to the health facilities. So, and then of course, new health facilities will be built across the 3 senatorial zones of the state, and then that means health services will be provided to the populace.
Na zo asibitin nan don neman taimako ne, saboda gaskiya suna kula sosai, suna ba da magani a kan lokaci, sannan kuma ba ɓata lokaci, kuma suna aiki cikin gaskiya. Saboda in na zo ana attending ɗina da wuri mai kyau, kuma ana ba da magani masu kyau a asibitin nan. Kuma nan kusa-kusa, kuma in na zo ina samun biyan bukata, shi yasa nake zuwan nan gurin. Da kan gaskiya sai ka je asibiti ka yi ta layi ka jira, amma yanzu kan gaskiya muna samun magani a kan lokaci, kuma gashi nan kusa da gida. Gaskiya Alhaji Zulum muna godiya, mun gode, Allah ya saka, Allah ya biya. Gaskiya dun kana taimakon talakawa irinmu, muna zuwa muna neman taimako kuma muna samun biyan bukata. Ba wani fa, sai dai kawai godiya ne. Gaskiya mun gode, Allah ya saka.
Ina farin ciki da aka kawo wannan asibitin, domin da kafin a kawo wannan asibitin, in kaman haifuwa ya tashi da daddare muna shan wahala kafin mu zo, amma yanzu da aka kawo wannan asibitin gaskiya mun samu sauƙi, saboda in haifuwa ya tashi da daddare mun kawo mutanenmu ana karɓan su. Sannan kuma gaskiya muna jin daɗi saboda muna samun magunguna, gashi kuma yaranmu ana musu allura. Kuma gaskiya dai mun ji daɗi da zuwan wannan asibitin sosai. Mun gode ma gwamnati da ta kawo wannan asibitin cikin wannan anguwa namu na Wulare. Gaskiya lokacin da babu asibitin, ko allura ne idan za mu ma yaranmu sai mun tafi wani guri daban can da nisa. Idan haifuwa ya tashi na cikin dare, in baka da abin hawa, shi ma ana shan wahala. Amma yanzu da yake asibiti ya zo kusa, ko da daddare ne in mun zo akwai ma'aikata kuma suna karɓan mu, gaskiya muna jin daɗi.
To muna shan wahala kam, amma mun ji daɗin shi. Daga baya an buɗe mana asibiti, akwai daɗi. Yaran mu ma mun kawo mun ji daɗin shi. Mai gida mun ma mun kawo mun ya ji daɗi. Sai godiya. Allah ya buɗa mana, su ma suna zama ba ne aiki a gida. Mu ma muna nema mu samu mu more, su ma su more, Allah ya buɗa musu. Allah ya gode muna, an ba mu ci da sha. Amma kam muna sha wahala, amma gwamna Allah ya ba shi abin da zai ba mu.
Gaskiya da farko da na fara zuwa asibiti nan, zazzaɓi ne yana damina sosai, amma da na zo kuma da suka bani magani ɗin da na sha, gaskiya na ji daɗin shi sosai. To tun daga lokacin ko ciwon kai yake damina ɗin, zan zo asibiti ina karɓan magani, in na sha kuma ina jin daɗin shi sosai gaskiya. Tun ina Shuwari ne inda na ji, tun an buɗe asibiti nan, in na zo kuma suna bani magani ɗin ina karɓa ɗin, in na je in na sha magani ina jin saukin shi sosai. Da fari kuma dama ainihi a kemis nake karɓan magani. Ina karɓan magani a kemis ɗin, kuma in na sha ɗin ba na jin daɗin shi, sai na zo na fara irin maganin itace na gargajiyan nan. Shi ma na sha, har yanzu ina ji ba daɗi. Da na zo na asibitin nan ina karɓa, ina magani ina sha ɗin, na fara jin daɗin shi. Tun daga lokacin na zo kuma sai ina karɓan magani ina sha. Yanzu ma na zo karɓan magani ne. Ainihi ina zuwa wani family care a kasan Wulare. A wajen nake karɓan magani ina sha. Yara na ma na tashi yanzu ko ba sa jin daɗi ma, sai yanzu ina karɓa musu magani a nan. Muna amfani da shi. A nan ainihi muke karɓan maganin mu muna sha. Gaskiya ina ma gwamnan Zulum godiya sosai wallahi, kuma mun zo ma ba kuɗi muke biya ba, muna karɓan magani mu, kowane kalan magani za mu karɓa mu sha. Muna jin daɗin shi sosai gaskiya, Allah ya taimaka mishi. Allah ya bashi lada, Allah ya bashi abin da yake so na duniya da na lahira gaba ɗaya.
Now, the hands-on approach of Professor Babagana Zulum in reacting to the wants and needs of his people continues to beat the imagination of citizens across the state who admire his drive and the insatiable quest to return glory and prosperity to Borno State and chart a new course for sustainable development for the state. The current trajectory indicates that the horizon is looking promising because of Babagana Zulum's stewardship. Now, the revamped and revitalized healthcare sector is just another shining example of Governor Umar Zulum's transformation agenda for Borno State and its people. Well, that's it for this week. Be sure to join us next week for more tales on Rising Borno Path to Prosperity. I'm Abdullahi Ahmed. We'll see you soon.